can't do that, it's abnormal and it makes them kind of crazy.
Yeah.
The best example I have of this really comes from the horse world, where we see dramatic differences between horses that are kept out in fields just with a run-in shed versus horses that are kept in a 12 by 12 stall all day, every day. And obviously, horses are large plains herbivores. They're supposed to be on a field moving around. Oh, sorry, I have some cat drama behind me. Um, and then we put them in this 12 by 12 box, and take them out 1 hour a day and work them and put them back, and they just go crazy. They're absolutely nuts, stereotypical behaviors, all kinds of things. And we're seeing that in dogs now too, as we have them live a less and less normal lifestyle for their species.
Yeah. Oh my gosh. In the last live that we did with Dr. Candazer, I have bottle babies. So don't worry. I had them crawling on me. Is everything okay?
I'm just going to stop this. They're scary.
Okay. She'll be right back with us, everybody. The life of a veterinarian, right? We gotta attend to our animals, make sure that they're safe. Everybody's good? Oh my gosh. It wouldn't be a great episode if we didn't have animal interruptions. We have to have those, right?
And behavior-based interruptions here, of course.
Of course.
We have almost no conflict in this household ever. And then right now they feel like they need to argue. Oh, it's going to happen again, probably. Oh, well.
It's kind of interesting because it's actually perfect timing, because I tell people all the time, like, your animals are so in tune to you and they know what's going on. And so when you're distracted and the attention isn't on them, a lot of times, even just like a little child, when mom gets on the phone, they want that attention. And so they act up. It's not different in everybody else's home. It's the same thing. As soon as you get on the phone, the animals act up, the kids act up, and it's because the energy has changed and they feel it. Would you agree?
Yes. And this is a part, so the dogs are living more abnormal lifestyles compared to normal dog life, but also compared to 20 years ago, we are living much busier, much more stressful, much harder lives emotionally for us. And of course, our animals that live in our homes and sleep in our beds and all of this, of course they pick up on that. And so they're experiencing increased stress as well. Even if you still, live on 20 acres and just open the door and let your dog run around and sniff outside and take them for walks every day, they're still likely to experience more stress than they would have in that similar kind of lifestyle 20 years ago, because you are probably more stressed.
Right. No, absolutely. That stress just gets carried down. Do you, when we talk about mental illness and we talk about it, what is that? A lot of times people just think, okay, that must be anxiety, but you defined it as much broader than that. Can you kind of help us define a little bit when we are talking about mental illness?
Yeah. So it's interesting you should ask this. Because of my own journey, I have a very interesting definition. So anybody whose brains do not function like the typical, we're talking more about neurodivergence nowadays, where your brain doesn't function like a typical brain does. And maybe it makes you more predisposed to anxiety or depression, or you have some other kind of difference. That alone doesn't make for mental illness, though. Mental illness is when that combines with usually stress triggers in your life, things like that, to cause you to have symptoms that affect your life in a negative way. So just because you're predisposed to depression and maybe look on the darker side of things most of the time doesn't mean you're having trouble until you are, until it starts affecting your function and making you miserable all the time. That's a kind of a different level of it. So this applies to just about anything we think of as a brain issue or difference, from things like autism to bipolar disorder, schizophrenia, paranoia, anxiety, depression, PTSD, which, a lot of these other ones are things that you're either born with or you're born with a predisposition for them. PTSD may be less so, and that's mostly related to traumatic episodes in your life and your brain not being able to process them at the time. I'm seeing lots more PTSD in dogs too, so that's why I specifically bring that one up.
Yeah, I see that. Well, as a groomer, we see it a lot, and it may not be, I'm going to kind of interject there, even as you'll probably see this as a veterinarian. PTSD isn't always because something horrible happened, it could be I didn't want to get a bath, or I didn't want to go to the veterinarian, and that scared me because I got I got a shot, or I got this. That can be PTSD. It's not always, and sometimes people hear the word PTSD and they just think, oh, someone abused the animal, but that's not it. It's what they consider traumatic, correct?
Yes.
Yeah.
I have a patient actually who he's from the shelter, but he was born at the shelter. He was a puppy born to a pregnant mom who came to the shelter, had a perfectly fine puppyhood there with a foster family, then was adopted by my clients who currently have him. So they know his whole life history.
Aww.
And he has anxiety related to PTSD because a garbage can lid closed one time on a walk and startled him. PTSD is just what happens in your brain when you experience a traumatic event that your brain can't process. And so for some of that, that's, serious, what we think of as big trauma, like combat trauma, or that's the classic one, of course, or physical abuse or things like that. But it can also just be some emotional event happened related to, maybe somebody raised their voice one time at you and you're just very sensitive. And so you weren't able to process that and you kind of shut down. And now that trauma is sort of stuck in your brain, stuck in your body. And that's PTSD just the same. And it can affect your life in the same level as the ones we think of as bigger PTSD.
Right. I just think you might need to.
Yes.
We're going to have to let her take care of that. None of us want to see a giant cat fight. It's interesting because for those of you who don't know, I run a cat hotel and I also have a doggy daycare. And I was telling our listeners, Dr. Ericka, that I run a doggy daycare and I also have a cat hotel. And I tell people all the time, I would rather break up a fight between a pit bull, a German shepherd, and a Rottweiler than two cats. Breaking up a cat fight, you need to stop it before it becomes one, because it's not pretty. They have all sorts of ways they can get us.
Yes. Cats are very pointy. Yeah.
And they can contort their bodies in all sorts of ways that you're like, what just happened? Why are you attached to my back? I can't get you off. So I was like, she's got to break that up. Trust me, before it becomes a bigger issue. So you had mentioned autism and a few other things. Is there any, I wouldn't even know how to not that I would diagnose, I'm not a veterinarian, but how would you, do animals get autism, do you think?
I think so.
Okay.
From my perspective as someone on the spectrum, I do think animals get autism, but